After eye bag surgery, my eyelids pulled down. What can I do?
Surgery for under-eye bags is a very popular procedure. Contributing to this popularity is that eye bags are associated with genetics and can be seen at almost any age. A wide range of doctors, from general plastic surgeons to other medical specialists, are willing to perform eye bag removal surgery. As a specialist, I can state without reservation that the under-eye area is deceptively complex, and achieving natural-looking results and avoiding complications is not always so straightforward. The eyelid support structures and muscles need to be well understood by the surgeon. The delicate balance of the anatomic relationships that is needed to avoid complications cannot be overstated. The fact that eyelid surgery is performed so close to the eye also adds a unique element of risk when compared to other cosmetic procedures. I'll discuss common complications that can happen after under-eye bag surgery, how they can be addressed, and how these potential issues can be anticipated to lower the risk of these complications. I'm Dr. Amiya Prasad. I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial, plastic, and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years. I was first trained in eye surgery before I specialized in cosmetic and reconstructive surgery of the eyelids. Patients come to our practice from around the world with a range of issues after eyelid surgery, in particular, lower eyelid retraction. Eye bag surgery can be done via two approaches: the transcutaneous approach and the transconjunctival approach. In the transconjunctival approach, which is my preferred technique, herniated fat that causes under-eye puffiness is sculpted with the intended outcome of you looking like it appears like you never had eye bags. No skin is removed, no external incision is made. I find this approach to be effective at preserving the complex and delicate support structures of the lower eyelid, which by keeping them intact results in my hands in avoiding common complications associated with lower eyelid surgery. The transcutaneous approach, on the other hand, involves making an incision right below the eyelashes to remove and sculpt the fat. It is a more traditional approach to lower eyelid surgery commonly taught to general plastic surgeons. With this approach, eyelid skin is often removed in an effort to tighten the skin. Wrinkled under-eye skin is often seen by surgeons to be in excess or redundant skin. In my experience, wrinkled skin is more due to poor skin quality, not excessive skin quantity. This is often where problems start because skin removal can lead to complications. As stated earlier, the lower eyelid structure can be deceptively complex. The lower eyelids in many ways are like a suspension bridge, so there are critical elements that keep that bridge up. The lateral canthal tendon that holds the eyelid to the bone, an area called the posterior and middle lamella of the eyelid, which acts like pillars to support the lower eyelid, and the anterior lamella, which is the skin in front of the eyelid. The muscle in front of the eyelid is the orbicularis oculi muscle, which acts like a hammock or sling to keep the eyelid in place. Very often, when lower eyelid blepharoplasty is performed through the transcutaneous approach, this delicate balance can be compromised. For example, when the supporting muscle is traumatized and skin is removed in the effort to reduce and improve wrinkles, the subsequent scarring that leads to complications such as eyelid retraction, where the eyelids are pulled down, or ectropion, where the lower eyelids evert outward. As a specialist with a background in ophthalmology, I can state that it is critically important that the lower eyelid be in proper position because it's not just about the aesthetics, but it's also about the health of the eyes. Proper eye function requires the continuous lubrication of the surface of the eye with tears. When the eyelid is everted or retracted, the natural distribution of tears and the proper protection of the eye is compromised. When I see a patient who has experienced a complication after eyelid surgery, I explain that the strategy of surgery is to restore anatomy. The questions that need to be addressed are, is there enough skin at the front of the eyelid? Is there enough support for the lower eyelid? Usually, in eyelid retraction, these issues are the foundation of the reconstructive procedure. You need support from the inside that typically requires some type of grafting procedure. A shortage of skin very often also requires skin grafting. The appearance of the skin graft during the early healing process and after healing is completed is of major concern for patients during consultation. I explained that I strive to achieve optimal blending of the skin graft with meticulous suture technique and the use of wound healing technology such as PRP or platelet-rich plasma and extracellular matrix at the time of surgery. Improvement of the skin graft appearance after healing may involve the use of different lasers. An important aspect of anatomical restoration is a structure called the lateral canthal tendon, which connects the eyelid to the bone structure. I surgically repair and reconstruct the lateral canthal tendon routinely as part of the procedure. In our practice, we do our procedures in our own certified facilities. We have dedicated staff that the patient gets to know very well from the time of their appointment to the time of their surgery and afterwards. We do this procedure under local anesthesia with light IV or intravenous sedation so that the recovery is more comfortable and is quick. Healing depends on your health and lifestyle. For example, if smoking compromises oxygen supply and causes inflammation, this all negatively impacts the healing process. Depending on the extent of the surgery, our patients typically are able to return to work in 1 or 2 weeks. Swelling continues to improve over several weeks to months. Full surgical healing, like any other surgery, is complete in about 1 year. Many people have come to us from around the world because they were upset about losing the character of the shape of their eyes after lower eyelid surgery. Restoring their characteristic shape with revisional eyelid surgery has made a significant impact on their self-confidence and sense of feeling attractive. If you've had lower eyelid blepharoplasty and you feel that your lower eyelids are lower than they should be, you may have lower eyelid retraction. I would advise you to address your concerns with your surgeon and see if the recommendations being made are to your satisfaction. If you feel that revisional surgery is needed, meet with a highly experienced cosmetic oculofacial plastic surgeon to learn about your options. I hope you found this information helpful. Thank you for your question.